Question 1. A licensed practical nurse, LPN, is caring for a client who is receiving intravenous 4 fluids. The client suddenly reports pain and swelling at the 4 insertion site. What is the LPN's most appropriate initial action? A. Apply a warm compress to the site. B. Elevate the affected extremity. C. Discontinue the 4 infusion immediately. D. Document the findings in the client's chart. Answer: C. Discontinue the 4 infusion immediately. This question addresses managing in 4 complication, specifically infiltration, which is indicated by pain and swelling at the site. The most appropriate initial action is to stop the 4 infusion immediately to prevent further fluid leakage into the surrounding tissue and reduce discomfort. While applying a warm compress or elevating the limb might be follow-up actions to aid comfort and absorption, discontinuing the 4 is the priority to halt the problem. For example, continuing the infusion would only worsen the swelling and discomfort, potentially causing more tissue damage. Always remember, when you suspect an 4 complication like infiltration, stopping the infusion is the first and most critical step. Question 2. The LPN is preparing to administer medication to an older adult client. Which age-related physiological change should the LPN consider when administering medications? A. Increased gastric motility. B. Enhanced liver metabolism. C. Decreased renal excretion. D. Improved lean body mass. Answer: C. Decreased renal excretion. This question focuses on pharmacokinetics in older adults, specifically how age affects medication elimination. As individuals age, their renal, kidney, function often declines, leading to decreased excretion of medications from the body. This means drugs can stay in the system longer, increasing the risk of accumulation and potential toxicity, requiring lower doses or less frequent administration. For instance, a medication that is normally excreted quickly might build up to toxic levels in an older adult with reduced kidney function. Always be mindful that older adults may need medication adjustments due to slower excretion, making them more sensitive to drug effects. Question 3. An LPN is providing care for a client diagnosed with heart failure. The client reports increasing shortness of breath, and the LPN notes crackles in the lungs and bilateral ankle edema. What is the most relevant information for the LPN to report to the registered nurse, RN? A. The client's last meal intake. B. The client's current pain level. C. The client's weight gain over the past 24 hours. D. The client's social support system. Answer: C. The client's weight gain over the past 24 hours. This question assesses the LPN's ability to identify and report critical data in a client with heart failure, specifically focusing on signs of worsening fluid overload. The key indicators of worsening heart failure, such as increased shortness of breath, crackles in the lungs, and edema, are directly related to fluid retention. A rapid weight gain, e.g., 2 to 3 pounds in a day or 5 pounds in a week, is often the earliest and most objective sign of fluid accumulation and worsening heart failure. For example, knowing the client gained 4 pounds since yesterday would immediately signal a need for increased diuretic therapy. When caring for heart failure clients, tracking daily weights is a crucial part of monitoring fluid balance. Question 4. A client with a new prescription for Warfarin, Coumadin, is receiving discharge teaching from the LPN. Which statement by the client indicates a need for further teaching? A. I should use a soft bristle toothbrush. B. I will avoid eating a lot of green leafy vegetables. C. I need to get my blood tested regularly. D. I can take aspirin if I have a headache. Answer: D. I can take aspirin if I have a headache. This question evaluates a client's understanding of precautions while on anticoagulant therapy like warfarin, with the phrase "further teaching" indicating an incorrect statement. Aspirin is an antiplatelet medication that increases the risk of bleeding when taken with warfarin, which is a strong anticoagulant. Therefore, the client should avoid aspirin and other NSAIDs, nonsteroidal anti-inflammatory drugs, unless specifically prescribed by their healthcare provider. For example, taking aspirin could lead to serious internal bleeding, so clients are advised to use acetaminophen for pain relief instead. Always emphasize avoiding over-the-counter medications that can increase bleeding risk when a client is on anticoagulants. Question 5. The LPN is assisting with the care of a client who underwent abdominal surgery yesterday. The client is experiencing nausea and has not had a bowel movement since surgery. The LPN assesses the client's abdomen and hears hypoactive bowel sounds. What is the most likely reason for these findings? A. Diarrhea. B. Normal postoperative recovery. C. Paralytic ileus. D. Appendicitis. Answer: C. Paralytic ileus. This question assesses the LPN's understanding of common postoperative complications, specifically related to gastrointestinal function. The keywords abdominal surgery yesterday, nausea, no bowel movement, and hypoactive bowel sounds strongly suggest paralytic ileus. Paralytic ileus is a temporary halt of peristalsis, bowel movement, after abdominal surgery due to manipulation of the bowel and effects of anesthesia, leading to absent or sluggish bowel sounds, nausea, and distension. For example, it's like the bowel has gone to sleep and needs time to wake up, differing from a normal recovery where some bowel activity typically returns. Always be alert for signs of paralytic ileus after abdominal surgery, as it delays recovery and can lead to complications. Question 6. An LPN is caring for a client with a new colostomy. The client expresses anxiety about learning to care for the stoma and states, "I don't think I'll ever be able to do this." What is the most therapeutic response by the LPN? A. Don't worry, you'll get the hang of it eventually. B. Many people feel that way initially, but with practice, it becomes easier. C. If you don't learn, you won't be able to go home. D. Let me show you again, it's really not that hard. Answer: B. Many people feel that way initially, but with practice, it becomes easier. This question tests therapeutic communication skills, particularly when a client expresses feelings of anxiety and self-doubt. The most therapeutic response acknowledges the client's feelings, normalizes their experience, and offers encouragement without dismissing their concerns. Telling them don't worry or minimizing the difficulty can be dismissive, while threatening them is counterproductive. For example, this response validates their current emotional state while providing a realistic and hopeful outlook on their ability to learn. Always acknowledge and validate a client's feelings before offering encouragement or solutions. Question 7. The LPN is preparing to administer a subcutaneous injection to a client. Which action is essential for the LPN to perform to ensure client safety? A. Administer the medication into the deltoid muscle. B. Aspirate before injecting the medication. C. Rotate injection sites with each dose. D. Use a 21-gauge needle for injection. Answer: C. Rotate injection sites with each dose. This question focuses on the safe administration of subcutaneous injections. The essential action to ensure client safety and comfort for repeated subcutaneous injections is to rotate injection sites. This practice prevents tissue damage, lipohypertrophy, lump under the skin, or lipoatrophy, denting of skin, that can impair medication absorption and cause discomfort. For example, if a client receives daily insulin injections, using the same spot repeatedly can lead to scar tissue and poor absorption. Remember that rotating sites is crucial for effective medication absorption and maintaining skin integrity with subcutaneous injections. Question 8. An LPN is caring for a client receiving total parenteral nutrition, TPN. The LPN notes the TPN bag is empty and the new bag is not yet available from the pharmacy. What is the most appropriate action for the LPN to take? A. Connect a bag of 5% dextrose in water, D5W, to the existing TPN line. B. Stop the TPN infusion until the new bag arrives. C. Flush the line with normal saline. D. Administer a bolus of intravenous fluids. Answer: A. Connect a bag of 5% dextrose in water, D5W, to the existing TPN line. This question tests critical thinking in managing TPN infusions, specifically when there's an interruption in supply. TPN solutions are highly concentrated with glucose, and suddenly stopping the infusion can cause rebound hypoglycemia, low blood sugar, because the body continues to produce insulin in anticipation of the high glucose load. To prevent this, a temporary infusion of 5% or 10% dextrose in water, D5W or D10W, should be started at the same rate as the TPN until the new bag arrives. For example, switching to D5W ensures the client continues to receive some glucose to prevent a dangerous drop in blood sugar. Always remember to hang a dextrose solution when TPN is unexpectedly delayed to prevent hypoglycemia. Question 9. An LPN is assigned to care for a client with Clostridium difficile, C. difficile, infection. Which personal protective equipment, PPE, should the LPN wear when entering the client's room? A. Surgical mask and gloves. B. N95 respirator, gown, and gloves. C. Gown and gloves. D. Face shield and gown. Answer: C. Gown and gloves. This question assesses knowledge of infection control and appropriate PPE for specific infections. C. difficile requires contact precautions because it is transmitted through direct contact with contaminated surfaces or individuals. Gowns and gloves are essential to prevent the spread of the bacteria from the client and their environment to the nurse and other areas. For example, wearing a gown protects your uniform from contamination, and gloves protect your hands. Always remember that C. difficile requires contact precautions, emphasizing meticulous hand hygiene with soap and water after removing PPE. Question 10. The LPN is reinforcing teaching with the family of a client who has Alzheimer's disease about safety in the home. Which instruction should the LPN emphasize most? A. Encourage the client to participate in complex tasks. B. Remove throw rugs and clutter from walking areas. C. Keep daily routines flexible to promote spontaneity. D. Allow the client to wander freely inside and outside the home. Answer: B. Remove throw rugs and clutter from walking areas. This question focuses on safety for clients with Alzheimer's disease, emphasizing environmental modifications. Clients with Alzheimer's often have impaired judgment, memory, and coordination, increasing their risk for falls. Removing tripping hazards like throw rugs and clutter significantly reduces the likelihood of falls, which are a major concern for this population. For example, a simple throw rug can become a serious obstacle for someone with an unsteady gait. Always prioritize fall prevention by modifying the home environment to make it safer for clients with cognitive impairments. Question 11. An LPN is assisting with the care of a client who has a chest tube connected to a chest drainage system. The LPN observes continuous bubbling in the water seal chamber. What is the initial action the LPN should take? A. Clamp the chest tube immediately. B. Increase the suction setting. C. Assess the tubing and insertion site for leaks. D. Document the finding as normal. Answer C. Assess the tubing and insertion site for leaks. This question tests the LPN's ability to troubleshoot chest tube drainage systems. Continuous bubbling in the water seal chamber, especially after the initial period post-insertion, indicates an air leak in the system. The initial action is to systematically check for the source of the leak, starting from the client's insertion site, along the tubing, and then at the connections to the drainage system. For example, a loose connection in the tubing could be causing the air to enter the system. Remember, persistent bubbling often signals an air leak, and locating and correcting it is the priority. Question 12. A client is prescribed a clear liquid diet. Which food item can the LPN offer to the client? A. Cream of mushroom soup. B. Orange juice with pulp. C. Gelatin. D. Sherbet. Answer C. Gelatin. This question assesses knowledge of dietary restrictions, specifically the components of a clear liquid diet. A clear liquid diet includes foods that are transparent and liquid at room temperature, providing minimal residue. Gelatin fits this description perfectly, as it is clear and dissolves into a liquid in the mouth. Cream soup, juice with pulp, and sherbet are not considered clear liquids because they contain solids or are opaque. For instance, chicken broth and apple juice are also examples of items allowed on a clear liquid diet. Always remember that clear liquids are those you can see through. Question 13. The LPN is reinforcing teaching about fall prevention with an older adult client at home. Which statement indicates the client understands the teaching? A. I will leave a dim light on in the hallway at night. B. I will wear my loose-fitting slippers around the house. C. I will rush to answer the phone when it rings. D. I will avoid using grab bars in the bathroom. Answer A. I will leave a dim light on in the hallway at night. This question evaluates the client's understanding of fall prevention strategies, identifying the correct statement. Leaving a dim light on helps improve visibility at night, reducing the risk of tripping or falling when getting out of bed. Loose-fitting slippers can cause trips, rushing increases fall risk, and avoiding grab bars removes a key safety measure. For example, simply turning on a small night light can prevent a dangerous fall in the dark. Always encourage older adults to ensure adequate lighting, especially at night, as a primary fall prevention measure. Question 14. An LPN is caring for a client with a nasogastric (NG) tube inserted for gastric decompression. The client reports abdominal pain and distension. The LPN assesses that the NG tube is not draining. What should the LPN do first? A. Irrigate the NG tube with normal saline. B. Reposition the client. C. Check for kinks in the tubing. D. Clamp the NG tube. Answer C. Check for kinks in the tubing. This question tests problem-solving related to NG tube patency. When a client with an NG tube for decompression reports pain and distension and the tube is not draining, the most common and easily fixable cause is a kink or obstruction in the tubing. The initial action should always be to assess the simplest potential problem first. For example, a simple bend in the tube under the client's arm or behind their back could stop the drainage. Always start by checking for visible kinks or blockages in the NG tube system before proceeding with more invasive interventions like irrigation or repositioning. Question 15. The LPN is preparing to administer insulin to a client with diabetes. The client's blood glucose is 50 milligrams per deciliter. What is the priority action for the LPN? A. Administer the insulin as prescribed. B. Notify the registered nurse, RN, immediately. C. Provide the client with a carbohydrate snack. D. Document the blood glucose reading. Answer: C. Provide the client with a carbohydrate snack. This question tests the LPN's understanding of immediate interventions for hypoglycemia, a critical do-not-miss condition. A blood glucose level of 50 mg per deciliter indicates hypoglycemia, low blood sugar, which is a medical emergency. The priority action is to treat the low blood sugar immediately by providing a rapid-acting carbohydrate snack to raise the blood glucose, rather than administering insulin, which would worsen the situation. For example, giving juice or glucose tablets will quickly raise the blood sugar to a safe level. Always remember that treating hypoglycemia takes immediate priority over administering insulin or just documenting. Question 16. An LPN is observing a new nursing assistant, NA, performing perineal care for a female client. Which action by the NA requires immediate intervention by the LPN? A. The NA washes from the perineum to the anal area. B. The NA uses clean technique instead of sterile technique. C. The NA washes from the anal area to the perineum. D. The NA uses warm water and mild soap. Answer: C. The NA washes from the anal area to the perineum. This question evaluates the LPN's understanding of proper perineal care technique and the need for immediate intervention to prevent infection. The critical principle of perineal care is to wash from the cleanest area to the dirtiest, meaning from the perineum, urethra and vaginal opening, towards the anal area. Washing from the anal area to the perineum risks introducing fecal bacteria into the urethra or vagina, increasing the risk of urinary tract infections, UTIs, or other infections. For example, this incorrect technique could transfer E. coli from the rectum to the bladder, causing a UTI. Always ensure perineal care is performed front to back to prevent infection. Question 17. The LPN is assisting with the care of a client who has a new tracheostomy. Which observation requires immediate notification of the registered nurse, RN? A. Small amount of clear secretions from the stoma. B. Client's respiratory rate is 18 breaths/minute. C. Audible high-pitched whistling sound during inspiration. D. Oxygen saturation is 96% on room air. Answer: C. Audible high-pitched whistling sound during inspiration. This question assesses the LPN's ability to identify a critical respiratory finding in a client with a new tracheostomy. An audible high-pitched whistling sound during inspiration, known as stridor, indicates upper airway obstruction, which is a medical emergency that can quickly lead to respiratory distress and arrest. Clear secretions and a stable respiratory rate or oxygen saturation are generally expected or normal findings. For example, stridor could mean the tracheostomy tube is partially blocked or dislodged, requiring immediate intervention. Always prioritize any signs of airway compromise, as they can rapidly escalate into life-threatening situations. Question 18. An LPN is reinforcing discharge instructions for a client going home with a new prescription for metoprolol, low pressor. Which instruction is most important for the LPN to emphasize? A. Take your pulse before each dose. B. Increase your fluid intake significantly. C. You may stop taking this medication when your blood pressure is normal. D. Avoid foods high in potassium. Answer: A. Take your pulse before each dose. This question tests the LPN's knowledge of essential teaching for beta blockers like metoprolol. Beta blockers can cause bradycardia, slow heart rate, so it is crucial for the client to check their pulse before each dose and to hold the medication and notify their provider if the pulse is below a certain threshold, e.g., 50 to 60 bpm, as instructed. Stopping the medication abruptly can lead to rebound hypertension or angina, and fluid intake or potassium restrictions are not typically primary concerns for metoprolol. For example, if their heart rate is too low, taking the medication could dangerously slow it further. Always educate clients on beta blockers to monitor their pulse as a key safety measure. Question 19. The LPN is caring for a client who is NPO, nothing by mouth, for an upcoming procedure. The client asks for a sip of water because they are thirsty. What is the most appropriate response by the LPN? A. A small sip won't hurt, just don't tell anyone. B. I understand you're thirsty, but you cannot have anything by mouth until after your procedure to ensure your safety. C. I will get you some ice chips instead, they are usually allowed. D. You can have water after your procedure is finished. Answer: B. I understand you're thirsty, but you cannot have anything by mouth until after your procedure to ensure your safety. This question evaluates therapeutic communication and adherence to NPO orders, which are crucial for client safety before procedures that involve anesthesia or sedation. The most appropriate response acknowledges the client's discomfort while firmly and clearly explaining the rationale for the NPO status related to their safety, preventing aspiration. Offering ice chips or allowing a sip of water goes against the NPO order, and waiting until after the procedure does not address the immediate thirst. For example, drinking water before surgery could lead to vomiting and aspiration of stomach contents into the lungs during anesthesia. Always prioritize client safety by strictly adhering to NPO orders and clearly explaining their importance. Question 20. An LPN is assisting with the admission of an older adult client who reports recent episodes of confusion and disorientation. The client's family expresses concern. Which action by the LPN is most appropriate for the client's safety? A. Encourage the client to remain in bed to prevent falls. B. Place the client in a room near the nursing station. C. Reorient the client every 30 minutes with the clock and calendar. D. Administer a sedative to calm the client's agitation. Answer: B. Place the client in a room near the nursing station. This question addresses safety measures for confused or disoriented clients, especially older adults. Placing a client with confusion and disorientation in a room near the nursing station allows for more frequent observation by staff without constant direct supervision, increasing overall safety and enabling quicker response to needs or changes in condition. While reorientation is helpful, it doesn't alone ensure safety, and sedation can worsen confusion. Keeping them in bed might lead to deconditioning or restlessness. For example, being close to the station allows the nurse to quickly see if the client is attempting to get out of bed unassisted. Prioritize constant or frequent observation for confused clients to prevent injury. Question 21. The LPN is preparing to administer medications to a client. The LPN notices that the prescribed dose is significantly higher than the typical dose range for this medication. What is the most appropriate action for the LPN to take? A. Administer the medication as prescribed, assuming the doctor knows best. B. Administer a lower, more typical dose. C. Contact the prescribing healthcare provider to clarify the order. D. Ask the client if they have taken this dose before. Answer: C. Contact the prescribing healthcare provider to clarify the order. This question tests the LPN's critical thinking and adherence to medication safety principles, specifically concerning drug dosages. When a prescribed dose appears unusually high or outside the typical range, it is the LPN's responsibility to question and clarify the order with the prescribing healthcare provider. Administering an incorrect dose, whether too high or too low, can cause significant harm to the client. For example, administering an unusually high dose could lead to toxicity or an overdose. Always remember that if a medication order seems incorrect or unsafe, clarifying with the prescriber is a crucial step in preventing medication errors. Question 22. An LPN is reinforcing teaching for a client with newly diagnosed type 2 diabetes regarding foot care. Which statement by the client indicates effective teaching? A. I should walk barefoot around the house to let my feet breathe. B. I will soak my feet daily in hot water to improve circulation. C. I will inspect my feet daily for any cuts or sores. D. I can trim my calluses with a razor blade if they bother me. Answer: C. I will inspect my feet daily for any cuts or sores. This question focuses on essential foot care for clients with diabetes, which is critical due to neuropathy and impaired circulation that can lead to non-healing wounds and infections. Daily inspection of the feet for any cuts, sores, redness, or swelling is a cornerstone of diabetic foot care, allowing for early detection and intervention before minor issues become major complications. Walking barefoot increases injury risk, hot water can cause burns without feeling, and self-trimming calluses with sharp objects is extremely dangerous. For example, a small cut not noticed could quickly become a serious infection. Always emphasize daily foot inspection and proper foot protection for clients with diabetes. Question 23. An LPN is observing a client with dysphagia, difficulty swallowing, during mealtime. Which finding would indicate the client is experiencing a complication? A. The client eats slowly and carefully. B. The client coughs frequently during meals. C. The client prefers soft, pureed foods. D. The client takes small bites. Answer: B. The client coughs frequently during meals. This question assesses the LPN's ability to identify signs of aspiration in a client with dysphagia. Frequent coughing during meals is a primary indicator of aspiration, meaning food or liquid is entering the airway instead of the esophagus. While eating slowly, preferring soft foods, and taking small bites are strategies to manage dysphagia, coughing is a sign that these strategies might not be fully effective or that the client is struggling. For example, if a client consistently coughs when drinking thin liquids, it signals a risk for pneumonia from aspirating. Always be vigilant for coughing or choking during meals as a sign of aspiration in clients with dysphagia. Question 24. The LPN is reviewing the plan of care for a client with a pressure injury on their sacrum. Which intervention should the LPN prioritize to promote healing? A. Applying a dry gauze dressing daily. B. Repositioning the client every 4 hours. C. Encouraging increased protein intake. D. Massaging the skin around the pressure injury. Answer: C. Encouraging increased protein intake. This question focuses on essential interventions for pressure injury healing. Adequate protein intake is crucial for tissue repair and regeneration, making it a high priority in the plan of care for clients with pressure injuries. While repositioning is important for prevention, and appropriate dressings are vital, nutritional support, especially protein, directly supplies the building blocks for healing. Massaging the skin around a pressure injury can cause further damage, and a dry gauze dressing is often not the best choice for wound healing. For example, without enough protein, the body struggles to rebuild damaged tissue, slowing the healing process significantly. Always emphasize sufficient protein intake as a cornerstone of wound healing. Question 25. An LPN is caring for a client who is prescribed an opioid analgesic for severe pain. What is the most important assessment for the LPN to monitor regularly? A. Blood pressure. B. Respiratory rate. C. Urine output. D. Level of consciousness. Answer: B. Respiratory rate. This question focuses on the critical assessment for clients receiving opioid analgesics. Opioid analgesics, while effective for pain, carry a significant risk of respiratory depression, slowed breathing, which can be life-threatening. Therefore, monitoring the client's respiratory rate regularly is the most important assessment to ensure safety and detect this severe adverse effect early. While blood pressure, urine output, and level of consciousness are also important assessments, respiratory depression is the most immediate and dangerous side effect of opioids. For example, if a client's respiratory rate drops below 12 breaths per minute after receiving an opioid, it's a critical sign requiring immediate intervention. Always prioritize monitoring respiratory status when administering opioid medications.